Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's lecture topic is acute pelvic infections. We divided this lecture into 5 sections. In the first section, we will talk about the defense of the genital tract, in which we will talk about the vulval defense, vaginal and cervical defense, and then also uterine and tubal defense. What are the different causative agents and what's the mode of spread of infection? Then in the second section, we will talk about pelvic inflammatory disease. What are the risk factors for developing pelvic inflammatory disease and what are the protective factors? And then what's pathology and clinical features of pelvic inflammatory disease? In the third section, we will talk about investigation and treatment of pelvic inflammatory disease, in which we will talk about some diagnostic criteria and what are the different investigations done. Also about some differential diagnosis and complications of pelvic inflammatory disease and how they are treated. In the fourth section of our lecture topic, we will talk about pelvic infections which are common after delivery and abortion. We will talk about the pathology, clinical feature, and management of post-abortal and postpartum infections. Then in the fifth section, we will talk about some other pelvic infections. What's the late sequel of pelvic inflammatory disease? What's pelvic infection after gynecological procedures? And what's the effect of IUDs and other contraceptives on pelvic infections? So that's all we will talk about in this lecture, which is acute pelvic infections. So hopefully you are interested to learn more about this lecture topic. So keep watching sqadia.com.